All right, today we are very lucky to have Lauren Adkins, Margaret Ansell, and Jane Morgan Daniel from the University of Florida's Health Sciences Center Libraries here to share some wisdom and some strategies from their experiences spearheading some community health engagement initiatives. So I am going to pass the controls over to you, and we can get started.
Hi, thank you. Hello, thank you to everybody for joining us today for our webinar, Framing the Future of Partnering with Your Community. I'm Jane Morgan Daniel, the Community Engagement and Health Literacy Librarian at the University of Florida's Health Science Center Libraries, and these are my colleagues.
Hello, I'm Lauren Adkins. I'm the College of Pharmacy Liaison Librarian.
And I'm Maggie Ansell, the Nursing and Consumer Health Liaison Librarian.
So all of you have been muted during the webinar, but we will have around 15 minutes at the end for questions. So please save your questions until then, at which point you'll be able to type them in the chat box. Thank you. So here are the topics that we'll be discussing today. We'll look at how community engagement and community outreach have been defined in the information sciences literature. We'll talk about some resources that you can use to learn about your community and its health challenges, and then about how to find and make connections with community groups. Sustaining connections is equally as important, so we'll provide some tips for building long-lasting community partnerships. And this, of course, ties in with institutional priorities. Even though we'd like to, no library can do everything, so we'll look at how to balance your community-based work with your other responsibilities. And finally, we'll talk about resources for community engagement and outreach, and look at some of the things that we've been doing here at the University of Florida over the last couple of years. And we'll also look at what we have planned for the future. Within librarianship, community engagement and outreach are sometimes considered two separate but overlapping concepts. Community engagement involves the librarian going outside of the library space to bring library services to the point of need. This usually occurs physically, with the purpose of interacting with community members and community groups directly at the point of need, so that's within community spaces. Community engagement initiatives are therefore outward-facing and should be customized with local health information needs in mind. The gold standard of community engagement is when initiatives have been developed through full collaboration with community groups, so that they are completely involved with the whole planning process. The community engagement approach eliminates a lot of barriers that traditionally limit access to library resources and services, such as academic libraries not being perceived as inclusive and welcoming to members of the public, or difficulties getting transport to the library, or even awareness that the health library exists. Although, of course, a primary disadvantage is that it depends solely on the librarian's physical presence in those places, so the impact of this approach can be very time-restricted. Community outreach initiatives, in contrast, typically encourage people to visit the library's online or physical space. The emphasis is on the community member to approach the librarian or the library to initiate resolution of their health information needs. For this reason, community outreach is more inward-facing and less of a participatory conversation. It tends to involve more barriers to access, as access is more dependent on the physical location of the community member or their digital literacy level. However, both approaches provide opportunities for librarians to facilitate connections between community members and health information. So it's important to try and plan and conduct both community engagement and community outreach initiatives whenever possible. So we have a question for you. Thinking about the last slide, where do you feel your library or institution needs to grow? Community engagement, community outreach, or maybe both? So please type your answers in the chat box and we'll give you a minute. So a lot of people are saying both, which makes sense. And also some people are saying community engagement, so that traditionally can be the hardest thing to implement, and that will be a lot of what we're talking about today. Great, thank you everybody. So we should be giving you some strategies for both outreach and engagement throughout today's talk. Okay, so learning about the population makeup and the health needs of your community are really important first steps. Designing library initiatives that have relevance and meaning for local populations becomes impossible if you have little to no understanding of the health challenges facing your community. Helpful resources to help you build your knowledge base include census data, recent state and county health plans, and data gathered by local community-focused research groups. For example, when researching the city of Gainesville, which is where the main campus of the University of Florida is located, I found out that Gainesville's population of 133,000 people is made up of a number of diverse groups in terms of race, ethnicity, health status, and socioeconomic status. So according to the census data, 15% of people speak a language other than English at home. 8% haven't graduated high school, and 22% are Black or African American, and 10% of people are Hispanic or Latinx. So the local health needs assessment that I've linked to on this slide is incredibly informative. When surveyed, a group of community members indicated that their primary health concerns are hypertension, diabetes, muscle and bone problems, weight problems, and cancer. So with all this in mind, it's absolutely essential to remember that there is no one-size-fits-all community engagement or outreach initiative. Diversity, equity, and inclusion are therefore essential considerations when pursuing community partnerships and when designing and implementing engagement and outreach initiatives. Although it sounds obvious, it's frequently forgotten that health communication, education, and information should all be tailored to specific population groups as much as possible. This slide shows some common diversity categories. This is super simplified, and of course there are many other categories. But the main point is that diversity categories like these contribute towards forming an individual's identity or identities. These identities influence a person's ability to achieve good health, and so in turn they're also linked to health disparities and inequities between different population groups. And it's important to remember that these categories all overlap and intersect with one another. A person's identities tend to influence their health beliefs, and this is primarily related to a person's perception surrounding the meaning of health, well-being, and illness, the acceptability of health procedures and tests, whether health providers and the health system is considered trustworthy, whether the benefits of a treatment are considered to outweigh the risks and the costs, who is responsible for health decision-making and advocacy. Sometimes it's a family member, in some cultures it's the patient themselves, and sometimes it's the health professional. And of course, thinking about the person's communication and learning style is very important. So, it's essential to be very mindful when selecting health information resources. Make sure to avoid materials that stereotype population groups, that only use images of white males, for example, or that are difficult to read because of medical jargon. Also, something else to bear in mind when meeting community members is that it's important to avoid making assumptions about the type of health information that a person may need based on their perceived age, race, ethnicity, gender identity, or sexual orientation. The next step after having learned about your local community is to begin searching for health-related community groups, community meetings, and events. Good places to start include low-cost clinics and social service providers, public libraries and schools, pride centers, faith organizations, and nonprofits. Reach out to representatives of these groups and use your elevator pitch before asking whether you can attend their meetings. Introductions are an absolutely crucial part of creating memorable and meaningful connections with people. So take 10 seconds at the beginning of your conversation or a short sentence at the beginning of your introductory email to convey what the library's role could be in relation to that person's own scope of community health work.
All right, now it's my turn. Hi. So in Gainesville, we currently actually have 3 main community-oriented meetings that we regularly attend. So the first one is the Partnership for Strong Families, and that is a state-funded social service organization with a focus on child welfare. Their resource centers actually include 3 branches of the county public library, and they partner with several other social service organizations in the community. This group is our most recent addition, and it's actually the most tangentially tied to our core mission, but it is an important place for us to build relationships with partners like the public library. Our second group is the Alachua County Safety Net Collaborative, which basically is a group that includes all of the low or no-cost healthcare providers in the area. It is our earliest partnership, and it includes several groups that we already work with in some capacity. For example, the Equal Access Clinic Network, which is staffed by students and faculty volunteers from the College of Medicine here at UF. Here we learn about relevant community health events that we may want to get involved in, such as health fairs. The UF Health Community Engagement Meeting is actually based out of the UF Health Care System rather than the community itself, but it is still an important opportunity for us to keep track of different community-oriented initiatives that our users may be involved in and that we may be able to support. For example, the head of our interprofessional service learning course, Putting Families First, attends this meeting and reports any new issues or needs for the program. Some of our librarians even actually serve as instructors for this course. Over the years, we've learned some important strategies for participating in these meetings. The first and foremost of which is to not have any preconceived notions of how you will be involved in the meeting. You might know all of the different ways that the library can help, but the organizations represented at community meetings know best what their needs are and what your potential role could be. For example, while our library has an established, successful train-the-trainer model where we teach staff and employees how to offer consumer health information services, some organizations, such as our local public library, are not equipped to host that kind of training, so we have to find other ways to partner with them. This brings me to my next tip, doing your research. Like the more general community research that we recommended earlier, it's important that you know exactly what services these community organizations provide and what potential needs that they might have before you attend the meeting. That's not always easy. Many community groups nowadays don't have anything more than a Facebook page when it comes to an online presence, or you might not even know who's going to be at the meeting, but we recommend that you do the best you can. Finally, have your elevator pitch ready and repeat it at each meeting. Based on your research, pick the most relevant services and resources that you and your library can provide, and be ready to succinctly describe them, as well as give a quick summary of who you are so that community members know who they potentially would be working with. This leads us to our next question of, okay, so we didn't give you any time to do this research because we just told you to do it, but in your communities, what are your local health needs that you're aware of? And what local community organizations could you reach out to start getting engaged with? So if you could type your answers into the chat, I'm going to be quiet for a second so that you can all put your answers in. We're loving the YMCA suggestion. We hadn't thought about that, but we're actually going to steal that for our own idea. Good job. And the addiction treatment, we have a local mental health facility, Meridian, that we can work with every now and again. That's really great. Yeah, I'm seeing some just suggestions as far as the needs. I know we asked a double-barreled question that is technically 2 questions, but it's great to see both answers. So yeah, isolation. We are in a rural area as well. That's really hard. Lack of broadband, that is a big issue. And yeah, I'm seeing a lot of, opioid epidemic, that's a big deal. Homelessness. Oh, I feel like this is like, it feels real right now. Yeah, so these are a lot of good organizations. I highly recommend keeping an eye on the chat because these are good suggestions. Mental health is a huge and a growing issue, and then one that's really tough to do sometimes because people have a hard time reaching out. So thanks for your responses, guys. This is really great. So it feels a little weird. I know it seems counterintuitive that after all the information and strategies that we give you to go out there and develop relationships in the community, for us to encourage you to say no. But it's important to recognize that building relationships takes time and effort. And if you are as busy as we are, you'll know that it is important to decide exactly what you'll be spending your time on. With that in mind, we encourage you to sit down with your administration, or yourself, if that's you, and discuss what topics, population groups, or organizations that you want to prioritize. For us, that means we can focus on health-related organizations in North Central Florida serving marginalized populations. And if there is some kind of connection to the university, all the better. If your library or the parent organization for your library has a strategic plan, use that to guide your efforts. If your work is aligned with the priorities of the strategic plan, you'll be in a better position to justify any costs or even request funding for supplies and activities. But in the end, it is a balance. Sometimes the perfect community partner that fits within your scope just isn't interested in working with you, but another more tangentially related organization is happy to have you on board. This recently happened to us when our director made some professional connections to the Okeechobee Public Library, which is much further south than our usual community engagement takes us. However, the Okeechobee Public Library was in the planning stages of having little free libraries installed throughout the county and was interested in filling them with trustworthy health information resources, as well as training their staff in health reference. Talk about a great opportunity. But in order to make this partnership work, we needed to pursue external grant funding to justify the time and effort put towards the project. So, we've talked about where to find partners and how to set priorities. The last step to preparing for engaging with your community is to identify, gather, and create the resources that will support your work. You might already have administrative support to fund your whole project and an amazing collection of print and digital consumer health resources at your fingertips. But for those who don't, we're going to outline some great places to start. So just to clarify, the National Network of Libraries of Medicine did not ask us to highlight their resources. It wasn't a condition of us hosting this webinar. We just think they have some really great stuff. And you would too, otherwise you wouldn't be here. You obviously know about the training opportunities available through NNLM, but did you know that they offer funding too? If you become a member of your regional network, for us at UF, that's the Southeastern and Atlantic region, you're qualified to apply for a variety of funding opportunities that are made available annually. Unlike the larger, more commonly research-focused grants that federal funders like the National Institutes of Health offer, these smaller grants, ranging from $5,000 to $15,000 generally, are perfect for community-based projects. You can use them to host health events, to purchase technology that allows you to share resources more broadly, and to pilot projects that reach out to new users. If you've never applied for a grant before, that's okay. The folks in NNLM will help walk you through the process. In addition to funding, NNLM has a huge variety of printable, downloadable, and, if you're a network member, orderable brochures, flyers, and other consumer health information resources. These are great for sharing with your community at tabling events or just having at the information desk. The information is up-to-date, trustworthy, and professionally designed, which saves you a lot of time and effort. Each region has their own page, but I've just listed the regions on the East Coast since I wasn't sure who would be viewing this webinar. I've also shared a link to a great community engagement toolkit created as part of the All of Us initiative that provides many more resources about how to engage with your community. In particular, I wanted to mention one other resource for SEA network members, the ability to borrow tabletop and standing banners from NNLM to use for outreach events. This is a new service and very exciting to me personally. I love the beautiful Library Transform banners, and I think they're perfect for using in community events.
So in addition to online resources from the NNLM, it's important to utilize local resources in your community. Now, depending on what stage you are at in your consumer health outreach program, it can be difficult connecting with the right local resources. Local resources can be a variety of different things that help you with your mission to provide consumer health information to the community you're trying to serve. Some of the strongest local resources can be local leaders that understand the current needs, landscape, and structure you are about to walk into. They understand the population you are trying to serve better than any statistic or preliminary research. For example, local leaders can provide valuable information such as, how does this community prefer to communicate? What are their most pressing needs? The answers to those questions will help dictate what resources to focus on. The leaders also know what framework and structure works best for these community health outreach events. They can guide you through the event logistics, how the event's set up, and is run overall. Another valuable resource is the people themselves. These are the local voices, and they know what they need. You have to be willing to take the time to listen to them and make them feel valued. Remember that no one likes being talked down to or made to be feel less than. I think it's safe to say we've all been in situations where we've seen someone being talked down to or someone treating someone with condescension, and maybe we've been in a situation like that ourselves. Providing consumer health outreach requires a lot of emotional intelligence and tactfulness. Due to a variety of factors, members of this community may have a lot of distrust of outside groups trying to help their community. When having a conversation with community members, and when you're trying to figure out what their consumer health needs are, remember that these types of conversations can easily come across as a conversation where the ones trying to provide the consumer health information can appear to be speaking down or at a group that many perceive to be less than due to their social or economic circumstances. People will recognize when other people are genuine and sincere. So, just as a reminder, don't treat them like a statistic or a problem to be solved. Take time to get to know the people you are serving. That's how you can find out what resources you have that could be the most useful. When trying to find local resources, don't forget to reach out to your fellow librarians. They could share valuable insight about their consumer health outreach program and lessons they've learned on the way. They could have valuable information about what has worked for them, what didn't work for them. They could even be looking for collaborators to help them with a large consumer health outreach project, and you may be the perfect partner to help them with that. For example, we have partnered with the Okeechobee Public Library to collaborate with them on providing little free libraries in their communities that will have consumer health resources. Geographically, our library is located right next to the U.S. Shands Hospital. Through our work as Health Science Center liaison librarians, we will come into contact with a lot of health professionals in a variety of healthcare fields. For example, Maggie comes into contact with the College of Nursing faculty and staff. Jane works with several departments in the College of Health Professions, such as occupational therapy, physical therapy, and more. In my position, I'm able to work with the College of Pharmacy and build connections with their faculty. Through that work, we are able to learn about their health outreach programs and initiatives, and we are in a position where we are able to advocate for our services to help provide consumer health outreach at these local events. That relationship and connection is also a two-way street. You may be in a position where you have a great idea for consumer health outreach and want to offer that opportunity for the professional community that you serve to participate. And just as a follow-up, always be on the lookout for potential collaborators. Oftentimes, the great opportunities have the ability to present themselves through that connection. So now, what resources does your community have to offer? Who would you like to reach out to? So remember to type your answers in the chat box. And we'll give a minute for this activity. That's a good one, student health providers on campus. Yes, local cancer center, women's center. And even if you're not sure, these are just some of the ideas where, you know, you'll be able to reach out and connect with them. Oh, that's good. When you primarily work with healthcare faculty, it's always good to be able to look out for those opportunities where you could also be involved with their outreach. Oh, it's great that your city does an annual health fair. All right. Thank you so much for your responses. Okay. Now we are going to go over 2 case studies that provided a lot of insights into how we provide consumer health outreach. What I love about these examples is that we're going to be able to share with you the lessons we've learned in successful situations and the lessons learned in events that were not as successful as we would have liked. For our first case study, we partnered with several organizations to provide consumer health outreach. All of these organizations come together at least 4 times a year to provide outreach services to a community in need in the East area of Gainesville, Florida. We were very lucky to be able to partner with these organizations because through their hard work and dedication to the community, these events are always well organized, well attended by the community, and successful in helping the community because many of the needs that are being met at the same time. Now I'm going to talk a little bit about each organization and the strengths they bring to these events. The first organization is the Bethel Seventh-day Adventist Church. They are physically located within this community and provide the location for these outreach events. They are also in charge of creating the organizational structure and flow for the event. It's very valuable to work with an organization that is able to create and enact structure when working with several different partners. When we arrive with our table and chairs, they will show us where we can set up, and they will introduce us to who our point of contact is going to be for the event if we have any questions or concerns. They are also great at keeping the activities organized in a way that participants don't feel overlooked or marginalized. They structure the event to where participants are able to get a ticket, and then they will call a certain number range to receive food from the local Armchair. If participants aren't able to carry their groceries to their vehicles, event volunteers will assist them and make sure they get what they need. They also know how to set a good mood for the event by playing popular worship and gospel music, and they also hold fun raffles for participants to receive gifts and other items. Partnering with faith and spiritual organizations can provide a wonderful opportunity to establish a partnership and strengthen the outreach efforts they are probably already providing. The second organization is Armchair, Feeding Florida Families. Their mission is to make sure that no Floridian goes hungry and no food goes to waste. This organization distributes fresh food free of charge to families, children, seniors, and individuals in need throughout Florida. They feed millions of people and distribute more than 88 million pounds of food annually. They also have wonderful donors and Florida farmers that provide food to be distributed. And if you are in Florida and you're thinking about partnering with them, they do not charge any organization or individuals for food. It's always impressive to see the Armchair semi-truck packed full of food and just the wonderful amount and variety of food they distribute to the participants. There will be huge bags of oranges, jugs of milk, glass of eggs, and so much more. These two photos actually don't show how much food they bring to each event. And what's really nice is that every participant will get a generous amount of groceries, which is wonderful to see. The last group in this partnership is Women Working with Women. This organization is involved in a lot of community enrichment programs around Gainesville. They provide a variety of services and opportunities for women in Gainesville, such as career workshops, computer classes and training, children and teen social development classes, and family counseling. They also help women who are transitioning back into society from incarceration. They work with women who are in an abusive relationship or situation, or if they're trying to leave an abusive situation. And they have been serving the women of Gainesville for many years. They work with other organizations to help provide free health screenings. At these events, they provide a lot of free clothing to give to the participants. Through that service, they are able to let the community know about their other wonderful programs that they have. In the past 3 years, they have been able to serve over 5,000 families. This is where we come in. Finding opportunities for collaboration can be as simple as searching local events on social media and reaching out to the coordinators to partner with them. At these events, we have a wonderful opportunity to provide consumer health information to those who are in need with limited resources. Through the hard work and dedication of all these other organizations, we are able to come to these events where the main needs of these participants are being met, such as food, clothing, and health screenings, and we're able to provide that consumer health information aspect. One of the things I noticed was that some of the participants won't see the value of the consumer health resources right off the bat. You may get confused looks of, why are you here? That's why it's important to be able to speak with participants and find out what their health needs are. Think of it as a mini reference interview. As you can see on our table, we have a lot of consumer health resources, but once we are able to find out what their needs are, we can provide them with consumer health resources that will be most helpful to them. Again, I want to talk about the importance of listening and communicating with the community. I spoke about this earlier, and I can't stress this enough. When you're trying to figure out what their consumer health needs are, it can easily come across as a conversation where you are speaking down to the participants. It's vital to actually take the time to get to know people you are serving. You also need to try to build a connection. Otherwise, you are handing them a piece of paper they won't read. I try to market the resources that I give to my mom to use, such as the portable health record wallet and the medication tracking pamphlet. When they learn these are resources that I use and my family uses, they can be more inclined to take what we are trying to give away for free. Lessons learned. You must be flexible. For example, I came to an event and the start time was 10 a.m., but they started at 9 a.m. So I had to hustle to get our table up and our information out there. Sometimes it's wise to bring your own table, chairs, and tents just in case there aren't any resources there for you. You can imagine the panic I felt when I thought I was 30 minutes early and actually I was late. I would always make sure that you have your own table and chairs just so you are prepared if there aren't any extra that the organization is able to provide for you. Personal preparedness. In terms of clothing, if you are outside, make sure you wear sunscreen, sun hat, make sure to bring your own snacks and water. You have to hydrate. Also, you may be going into a community that has a reputation for crime. At my first event, one of the organizers told me to be careful where I parked my car because people, quote, would bust your window out and steal your stuff. I don't know if she was speaking from personal experience, but I tried to find a safe location to park, but I also wanted to make sure that that person's prejudice didn't affect my goal of serving the community. As a follow-up, my car has not been broken into in the several events that I've attended there. You also need to be prepared for anything. You never know what you're going to encounter in a community member or situation. For example, we had one woman that passed out in front of our table, and we had to help stabilize her before the EMT came. It was a very hot floor today where you feel like the air has become lava. We were encouraging people to drink water, sit in the shade, and rest. One woman just passed out in front of our table, and so we quickly provided cold water, a chair, shade for her to recover in. The organizers quickly came to oversee the situation, and the EMTs were called, and the woman was taken to the hospital. Thankfully, she was okay. So overall, you just have to be ready for anything. Talk to other partners there. Opportunities can arise out of chit-chat, and the next thing you know, you can be invited to another great event. We were able to connect with several other groups that were tabling and learned of more events where we could also participate in and provide consumer health resources. Case study number 2 is a wonderful example of how the best laid plans cannot be successful. The U.S. College of Medicine has a celebration of Diversity Week. So last year, we were invited to come to an equal access clinic event that was providing free health screening. They had the face painting booth, they had balloons, food trucks, all the health students ready to provide screening, and we were there to provide consumer health resources. You could tell a lot of money had been invested in this event. As a side note, that's also why it's great to collaborate, because that also means your budget for outreach can collaborate with others and more oftentimes larger budgets. So again, we have this wonderful event, the face painting, balloons, food trucks, but unfortunately, there was such a low turnout, probably 10 to 15 people in 3 hours. It got to the point where we were waving signs by the side of the road with students to get people to come into the clinic. We also went to a seafood store nearby and let people know there was a wonderful event going on next door. However, our turnout was still low. Looking back, something that was probably a factor was that there were several other events that were happening in town on that same weekend. And in our situation, there was a carnival located 3 minutes up the road. That's where connecting with local resources come in handy. They will know what days and times will be most effective for your event. I mean, if I had a choice of a free health screening or going to a carnival, I'm probably going to choose the carnival. It can be pretty defeating and disheartening when best laid plans are made and no one turns up. However, you have to find the silver lining. In this case, we were able to solidify our connection with the College of Medicine diversity, equity, and inclusion leaders. They saw our commitment and dedication. That connection meant that this year, a whole year later, we've already been asked to plan and contribute to events for the U.S. College of Medicine Diversity Week. We went from the position of where we were asking to participate in these events to becoming a collaborator, and we were able to be involved in the planning stages of this week. For us, that was a sign that our hard work paid off. Sometimes the connections you make will not have the results as quickly as you would like or in the way that you thought it would, but the work you put in can bear fruit down the line even if you can't see it in that moment. Over the past several years, the HSCL has established strong partnerships and participated in a lot of community-based events. This has given us the privilege of sometimes having more opportunities than we currently have staffing for. Jane, Maggie, and myself, our schedules are already packed, so unfortunately, we don't have the time to go to every single event. One of our goals is to create a streamlined process for participating in these consumer health outreach events. In doing so, we hope to empower all HSCL staff members and faculty that want to participate in these events. Through that process, we hope to create a larger on-the-ground team that will feel empowered to go and provide consumer health resources at these events. We also have some exciting upcoming projects, such as our partnership with the Okeechobee public library, where we will be helping them provide consumer health information in their community through Little Free Libraries. And we've also made a wonderful connection with the Alachua County Public Libraries. We have been invited to table at their next Health and Wellness Expo. If you would like some further information about any of the topics we've covered today, please feel free to email any one of us. Additionally, we've created some LibGuides that could be helpful to you if you'd like to learn more. This LibGuide has links to a number of health resources that have been written specifically for diverse population groups. We also have a LibGuide on consumer health information resources in general, so please check this out whenever you have time. Thank you so much for listening. Do you have any questions for us? We have around 15 minutes, or 20-ish minutes, so please type any questions you have in the chat box now.
Thank you so much for your presentation. While people are thinking or typing, I was wondering if you had any suggestions on or any insight onto how you are able to take the time to get to know participants. You touched on a few times a very important idea that you need to make sure that you're really able to listen to the community members that you're trying to reach. But as primarily academic librarians who aren't working with these populations every day, do you have any suggestions for how to sort of create these sincere interactions?
Yeah, of course. I mean, unfortunately, it does take time, and honestly, that's where going to the community meetings really comes in handy, because especially if they're meetings that you aren't hosting, that you're just sort of sitting in at and participating in, because that's when you get to hear, like, the agenda is set by the community organizations. They have their own speakers and their own sort of work that they're doing, and you're mostly there just listening and then offering services if it becomes relevant. So it feels like a huge, like, time commitment to spend like once a month, or maybe once a week if you have to, going to these meetings and hearing the work of these organizations. But by sort of being a physical presence at these meetings, you can kind of become a known quantity. Similarly, if there are any kind of social events or sort of gatherings, so even if you're not tabling at a health fair, if there's some kind of event that one of your community organizations is hosting, like, just go as a person. Like, go to that event, like, hey, I'm from the libraries, I saw your advertisement for this event, and I'm really excited about it because I'm passionate about consumer health for such and such reason. And that, again, makes you sort of more of a known quantity, just because you took the time and spent the time doing it. So, like, it's definitely not cheap or easy to do in the sense of time. Like, you do have to spend the time doing it, but being able to have people recognize you and know your name and know what you provide is very helpful in building trust.
Thank you.
I just want to add to what Maggie said. So this is Lauren. In my personal background, I grew up in church, and so one of the skills that I've learned in church is the art of chit-chat. So when you are at your event and you're tabling, you can ask them questions that aren't health related. How are you doing today? How's it going? And then sometimes they just want to be listened to. You know, how's your day going? Oh, you know, you like this particular sports team? That's amazing. Oftentimes, if they're older individuals, they like to talk about their families, their children, and their grandchildren. And so it's just take time to connect with them on that level and just find out more about them as a person. And oftentimes when you establish that chit chat and just these small questions, they're going to be more likely, they're going to be more open and receptive to what you're trying to give them. So just if you don't have those, I guess, networking or chit-chat skills. I know there are several ways to develop them, but yeah.
Hi, this is Jane. When I'm tabling at community events, I like to start with opening by saying that we're consumers too in terms of health information. So librarians here, at least, are not health professionals. We have to learn everything that we know about consumer health information and about how to find reliable resources. And so by kind of breaking down those barriers and showing people that we're in the exact same boat as they are, it often helps people feel more comfortable opening up and talking to you.
We also have another question about trying to create an open data civic dashboard so that very similar to what a lot of communities have. So we are very fortunate insofar as a university-based hospital system, they have a mandate to create, to do a community health needs assessment as part of some grant funding and federal funding that they receive. And so U of Health is actually the one who hosts the local health dashboard for that. So unfortunately, we don't have a lot to do with the dashboard itself, but I do recommend that you check out some of those kinds of initiatives to see, yeah, because in order to be able to get support for doing kinds of community health options or community health projects, yeah, it is very important to have the data that backs that up. So it's a really real need. And when you're trying to figure out the sensitivity of that data, there are standard methods to basically anonymize the data to say, like, okay, you know, the people in this zip code, there's a higher proportion of folks with diabetes in this zip code, but we're not going to tell you who. It's just sort of they'll maybe do health statistics by zip code in order to help make it sort of more anonymous, and they won't sort of assign information that way. Or if there's, say, a very, very small proportion of people who have a specific disease, they might not include that statistical data because it's then like, oh, it's that one guy who has that one disease. We all know Bob who has random, you know, obscure disease here. So it's kind of, there are ways, sort of standard methods for anonymizing and making sure your data is sort of more central. So the CDC actually has a lot of really good information on how to do this. So I highly recommend you check out some of their health data privacy resources, because it's literally the CDC is what they do. So I hope that helps answer your question. I'm sorry we can't give you a how-to, but it's definitely challenging. And when it comes to dealing with specific library patrons and privacy, that it's not actually too different from the typical privacy that the public libraries like to have for sort of patron reading records and things like that. If the patron chooses to give you information about their health, that's their choice. They get to do that. You can show them health resources, but you should definitely caution them, like, but think before you fill out a form online that asks for private health information, because that's being taken down by somebody, and you might not like that. So that's kind of a thing you can do as well. And then let me try to see, any additional tips on finding successful partnerships in the southeastern Mid-Atlantic area? Well, the person who is on the planning committee for the Southern Chapter of the Medical Library Association says, join the Southern Chapter of the Medical Library Association, because we have a lot of cool resources and are a great place to meet other medical librarians in the area. But obviously, that's not always an option for everyone, but I highly recommend it. Jane also has to.
Hi, this is Jane. So as I said earlier, I'm a community engagement and health literacy librarian. And I've been in my position for a couple of years, and as I'm developing and learning, I'm meeting more and more community engagement and health literacy librarians. It seems like there are more job descriptions kind of growing out of academic institutions, and I think as well as some hospital libraries. So I would say it's definitely worth Googling these librarians, because they do exist. There are lots of us out there, and we're growing all the time, and we like to share our expertise and collaborate, because that's how we learn. So reach out to us and others in your area.
And so, yeah, I definitely recommend people checking out the chat because there's some really good suggestions about partnerships. So, yeah, charter schools are great. And then talking to, yeah, NNLM classes is another excellent example. Thank you, Kristen, for mentioning that. If you want to find a community of interested folks who are passionate about consumer health, like take an NNLM asynchronous class, and there's a ton of discussion boards, and there's like a whole introduction section on the first week. I've taken 1,000 of them. They're so fun, and definitely use those as an opportunity to meet others who are passionate about making sure people have access to trustworthy health information.
This isn't specifically related to the partnerships within the southeastern Mid-Atlantic area, but I wanted to comment on a partnership that Jane and I were successfully able to make for the UF College of Medicine Diversity Week. Last year we were in the situation of, we just saw it advertised and we thought, that sounds amazing. How about let's see if we can collaborate with them and we can help build a panel for them. And so this was something, it was an example of us hey, this is something that we could assist and join them and help them with this event. And so even if you have ideas and you don't have a relationship with them, feel free to have the courage to just go and pitch that idea. And so that I wanted to elaborate a little bit more about that example, because we were able to go from they did not think of us as a collaborative partner, and then now this year for the second annual Diversity Week, we're already being considered a partner and we're involved in the planning stages. So if you see something and you think that you'd be able to contribute to that event, just go ahead and reach out to them.
So I was trying to answer via chat some questions about the little pamphlets and things that we received. So I did provide links to some of those resources in the slides. So once Kirsten sends out the links to the presentation and things like that, you'll be able to follow up on those links. It kind of varies because just depending on federal funding and various rules and supplies and things like that, sometimes you'll be able to just, order these cute little, that's the little wallet cards were these Medline Plus branded wallet cards that I think 5 years ago we ordered, I feel like a metric ton of them. And so we still have them from 5 years ago because we just keep giving them out, and it's like they just multiply when we're not looking. And it's great because then we can just give a ton of them away. But I would definitely scope out. Sometimes the different government organizations or nonprofit organizations have funding to give you free stuff. Sometimes they don't. So always go back and keep checking, keep asking, because you never know what sort of is lying around. But yes, highly recommend a good wallet card. Those are popular giveaways because people like the idea of being able to write down their blood pressure or their medications. And if there happens to be an advertisement for Medline Plus, then so be it. We definitely have gotten to very good at having sort of an elevator pitch about consumer health things, like literally just saying don't Google your symptoms, go to Medline Plus. So you get very used to sort of your standard spiel about consumer health. So any other questions? I don't think I see anything coming across the chat, but I'm just double checking.
All right, great. Thank you so much. I'm going to go ahead and grab presenter privileges back here.
Do it. Field them.
All right. So thank you all for attending today's presentation. So as a reminder, this is being recorded. It'll be posted on the NNLM YouTube page as soon as possible. And I will email you all with a link to the recording and the slides from today's presentation, and then the MLA, the all-important MLA, CE, and evaluation link is on the screen. Let me drop it into the chat box so that you can actually click on it. And that will be included in the email that I send out as well. So Thanks again to everyone for attending, and a huge thank you to Lauren, Margaret, and Jane for your time and your insight. Have a good afternoon, everyone.